So this privileged speech is entitled Clean Our Water, Save Lives. For the past few weeks, the people of Iloilo have been haunted by the threat of another disease. As of September 4, 2022, the Iloilo City Health Office has recorded a total number of 354 cases of acute gastroenteritis, with 9 deaths and 8 positive cases of cholera. Just as we feared it would happen, the cases have now penetrated the province of Iloilo. As of September 9, 2022, the Iloilo Provincial Health Office has recorded a total number of 26 cases of acute gastroenteritis, 15.56% of which is still admitted in various hospitals, 10.36% are at home under medication, and only 2.7% have recovered. The youngest is a 2-month-old female infant from kabug-usan, who is, as of writing, still admitted in the hospital, followed by another 10-month-old female infant from Barangay Manduawag, Sangguniang Iloilo, who fortunately has already recovered. What is more, last September 6, 2022, the very first case of cholera in Iloilo province, particularly in the municipality of Oton, was already confirmed by the Iloilo Provincial Health Office. It was followed by another case in the municipality of Pavia. One culprit identified in Iloilo is the use of unsanitary drinking water in several fast food chains and water refilling stations. There have been allegations that several water refilling stations have unsafe water source and unsuitable filtration system, some of which are operating without proper sanitary or business permits and or health cards by employees. Still another cause identified is the continued practice of open defecation in some areas in both the city and province of Iloilo. Upon research, we have learned that cholera is an acute diarrheal illness caused by infection of the intestine with Vibrio cholerae bacteria. People get sick when they swallow food or water contaminated with cholera bacteria. The infection is often mild and without symptoms, but can sometimes be severe and life-threatening. On the other hand, acute gastroenteritis is a common infectious disease syndrome causing a combination of nausea, vomiting, diarrhea, and abdominal pain. People refer to it as food poisoning. According to the official records on file at the Bureau of Health for the Philippine Islands, now Department of Health, the last case of cholera pandemic was reported to have occurred on March 1904. During that period, a total of 166,252 cases were reported, and with 109,461 deaths. If we haven't learned from the lessons of the past, we are just doomed to repeat the same mistakes in the present. It is very unfortunate that as we are just beginning to recover from the harsh economic upset of COVID-19, another imminent threat to the lives of the people is beginning to surface. It is like a ticking time bomb waiting to explode at any moment. Before our hospitals are swarmed with patients of gastroenteritis or cholera to an unmanageable level, the Iloilo provincial government need to make a deliberate plan. We need to take urgent measures to halt the advent of yet another outbreak. Hence, in light of the foregoing, this representation would like to pass the following resolutions. First is a resolution requesting the Department of Health, Region 6, Iloilo Provincial Health Office, together with the municipal health offices / city health office of all 42 municipalities and one component city in the province of Iloilo to conduct mandatory potable water testing of all water refilling stations located within the province of Iloilo, and to inspect whether all water refilling stations in the province possess the necessary certificate of potability and sanitary permits to operate. Number 2, a resolution calling for a committee investigation on whether the Water Code of the Philippines, under Presidential Decree number 1067, dated December 31, 1976, providing for the utilization, exploitation, development, and conservation and protection of water resources, is being implemented in the province of Iloilo. Third is a resolution encouraging the general public to use fully boiled water for drinking and or to buy water only from licensed water refilling stations and other known source which must be FDA approved, with further reminder to avoid consumption of improperly cooked food. Furthermore, it is suggested that this matter be referred to the Committee on Health and Sanitation for the possible crafting of a new ordinance or amendment of existing provincial ordinance number 2015-120 or the Sanitation Code of the Province of Iloilo. About 60% of an average adult human body is composed of water. We don't drink to die. Save our water, save lives. Thank you very